Okay, I have Amanda Jones. She's a 66-year-old Caucasian female who has hypertension, diabetes, mellitus type 2, hyperlipidemia, coronary artery disease, diabetic neuropathy, and an MI 2 years ago with a single stent placed in her LAD of her heart. She's 5'6" and weighs 225 pounds or 102.3 kilograms. She's a non-smoker, doesn't do recreational drugs or alcohol. She leads a moderately sedentary lifestyle and is retired and watches her 2 grandchildren twice a week. For diabetes, she takes metformin 850 milligrams PO daily. Side effects include nausea, vomiting, diarrhea, flatulence, hypoglycemia, which is like tachycardia. She can get diaphoretic. Other signs and symptoms of hypoglycemia. And it can be potentiated some more or additive effect with hypoglycemia and with insulin or anti-diabetic medications taken along with it. So you have to do blood glucose checks, hemoglobin A1C checks, fasting blood glucose checks, but daily blood glucose checks throughout. Also, a low-dose Lispro scale of insulin, sliding scale, AC and HS. Again, anxious, nervousness, behavior change, blurred vision, cold sweats, confusion, difficulty thinking, dizziness, lightheadedness, excessive hunger, increased heart rate, fever, chills, headache, irritability, nightmares, painful or difficult urination, shakiness, slurred speech, tingling of the hands, feet, lips, or tongue, unconsciousness. Again, the same thing goes for monitoring your blood glucose daily, your hemoglobin A1C, and a fasting blood glucose. Same thing goes for having insulin Detromir 20 units sub-Q at bedtime. For her heart, she has ordered metoprolol succinate ER 25 milligrams PO daily for hypertension. As the patient had a small MI 2 years ago, and beta blockers are the standard of care in those who have an MI according to the American Heart Association. Also to the American Diabetic Association, she should also be taking an ACE inhibitor like losartan, 50 milligrams PO daily for hypertension, especially with a type 2 diabetic. With losartan, you need to avoid high intake of potassium, especially in sodium substitutes, because it can cause hyperkalemia. Also, grapefruit juice can delay or cause its active metabolite to be decreased, and so not as likely to work. Metoprolol succinate has side effects of blurred vision, chest pain or discomfort, confusion, dizziness, fatigue, faintness, lightheadedness, some orthostatic hypotension, shortness of breath, slower irregular heartbeat, sweating, unusual tiredness or weakness. It can mask hypoglycemia, and regular monitoring of the blood glucose level throughout the day is necessary. You need to also monitor your blood pressure and heart rate before you take. You need to take with food because it increases your absorption. Metoprolol also has an additive effect when mixed with alcohol, which can cause severe low blood pressure, so you should not take it with alcohol. Multivitamins can also decrease absorption if they're taken at the same time. For hyperlipidemia, she needs to take simvastatin 10 milligrams by mouth at bedtime. Side effects include dizziness, fainting, or irregular heartbeat. That's the standard of care, by the way, by American Heart Association and the American Diabetic Association. You need to monitor the cholesterol, triglycerides, LDL, and HDL levels with your primary care checkups and before starting. Again, do not take this medication with grapefruit juice, as it greatly increases the simvastatin levels that can lead to liver damage or rhabdomyolysis. For the stents in her heart, she was taking Plavix and aspirin. Plavix, 75 milligrams PO daily, is a blood thinner for the stent, and along with the baby aspirin is the standard of care with the American Heart Association. So Plavix side effects include chest pain, Collection of blood under the skin, deep or dark purple bruising, itching, pain, redness, swelling, pain in general, red or purple spots on the skin varying from size to pinpoint to large bruises. Rarely ever there's black tarry stools, nausea, vomiting, abdominal pain, coffee ground emesis, and if this happens, you should definitely call the doctor and or go to the emergency department. So again, monitor your output, your stool. Make sure it's not black or tarry. You're not barfing up blood or coffee ground emesis. You need to go to the doctor for that. Also, just monitoring your skin for too many bruising. Avoid NSAIDs and alcohol as it can increase your risk of bleeding. Same thing goes for aspirin. Don't take with alcohol or NSAIDs. It can increase your risk of bleeding. And also the side effects for an aspirin is just some minor upper GI symptoms. And for her diabetic neuropathy, she takes gabapentin, 100 milligrams PO 3 times a day for diabetic neuropathy. That can cause fatigue, viral infection, ataxia, nystagmus, fever, dizziness, and drowsiness. You can also get very clumsy or unsteady, so you have to monitor that if you're too unsteady or have too many involuntary or not meaning to have accidental injuries, then you need to probably stop that and call the doctor. Lifestyle modifications recommended by the American Heart Association and the American Diabetic Association is eat less sodium, maybe like the DASH diet, eat more lean meats and fruits and vegetables. Also, exercise regularly to decrease blood pressure, increase cardiovascular health, and help to lose weight. Regular checkup with your primary care doctor is also mandatory to keep a healthy lifestyle, as well as maybe getting a nutritionist. And then this is right here is a little handout I can give along with the side effects handout. And this it's from the American Heart Association, American Stroke Association Support Network. It's for seniors. It says to pick 8 to 10 of these exercises and do them 6 to 8 repetitions at least 2 days a week for brain, heart, and body benefits. So a little informational pamphlet for them would be necessary as well. I would do the drug-to-drug interactions also. There are just some minor interactions. There's moderate ones. So, of course, with the insulin Detromere and the Lispro, and the metformin, you want to make sure that you don't have too low of a blood sugar. So again, regular checking would help with that. Also, my printout I can't read. Again, it's just mostly the grapefruit juice has a really big player. No alcohol, so that's good that she doesn't drink. There are just minor interactions with metoprolol and aspirin. It can sometimes blunt the antihypertensive effects. Everything else is a moderate. Again, metoprolol can mask the signs of hypoglycemia. So that's the big one to worry about and make sure that doesn't go wrong. If you have any questions, let me know and I will help you.